This is a dosimetry badge. It measures exposure to radiation through a small piece of film that's sealed within a light-proof shield within the badge. We send ours to PL Medical via Henry Schein every 3 months for readings. It should be worn whenever you're in the radiology suite or otherwise exposed to radiation. Our machine is currently off, which is why I'm not wearing it right now. When you do wear it, you want to wear it on the thyroid shield so that you get the most accurate reading. And for anyone in this clinic, their readings for the maximum permissible dose for the year is no more than 5 rems. So here I have a dosimetry report for a coworker that was sent back after a reading at PL Medical. The maximum permissible dose for this clinic is 5 rems per year, which is equivalent to 5,000 millirems. This is looking at her deep radiation, eye radiation, shallow radiation. And currently this coworker is at 11 millirems for her deep radiation and 10 millirems for her eye and shallow radiation. I know that she is well below the 5,000 millirems of maximum permissible dose per year, so she is still okay to take x-rays. Our personal protective equipment here includes lead aprons, lead gloves, lead thyroid shields. You can also, some clinics do have special glasses to protect against scatter radiation. We do not have those here. You can also have protective walls, or we have a foot pedal on a very long cord that actually allows us to step outside of the room to take the x-ray, which helps decrease scatter radiation as well. And before I put on any protective equipment, I always inspect it. I'm looking for any sort of cracks in either the shield or the apron or in the gloves themselves, any bite marks, any sort of wear and tear that would mean that I'm not going to be protected against scatter radiation, as well as I want to make sure whenever I'm wearing gloves of this style that my hands are all the way through the glove, as opposed to this, which is not going to protect against scatter radiation. Once you've inspected your gear and you're ready to go, making sure that there are no cracks in any of the protective equipment, you want to go ahead and put it on. So we start by putting on our apron. And we put on our thyroid shield, making sure that the thyroid shield is outside of the apron, covering the thyroid fully. And then we put on our dosimetry badge onto our thyroid shield. And then we put on our gloves. And now we can properly take x-rays. Patients can be restrained for radiographs in one of 3 ways. They can be restrained manually, they can be restrained non-manually, whether it's with ties or tape, or they can be restrained chemically. The use of positioning aids help keep the patient in the correct position for the x-ray, as well as offer some comfort during the x-ray. Those include V-troughs for ventrodorsal views. You can use foam wedges, bean bags, or sandbags to help keep proper positioning and keep the patient from rolling, as well as any sort of bandage and tape to help keep the area of study in the correct position. There's also walls and doors, other protective barriers that you can use to keep yourself away from the radiation. Here we're fortunate enough to have a foot pedal with a very long cord that lets us stand outside of the radiology suite while we take the image, so we're not near the beam. Anytime that you can increase the distance from the primary beam and lower the exposure time will lower your exposure to scatter radiation. No portion of your body, whether shielded or unshielded, should come in contact with the primary beam because of its damaging effects both long-term and short-term. The shield does not protect against primary radiation, only the scatter radiation. Non-essential personnel should not be in the room during any x-ray to avoid any unnecessary exposure to radiation. Likewise, diagnostic images should be taken on the first try every time so that you are decreasing the exposure of radiation to both the patient and to the technicians taking the x-ray. Anyone under the age of 18 and pregnant women should not be taking x-rays because of their risk of radiation injury. Their bodies have cells that are rapidly reproducing, and the radiation can actually damage the cells to the point where it cannot be repaired or even kill the cell. I also have her information here that has her name, breed, her ID number for the clinic, her birthday, her weight and whether she is spayed or not. So I am now going to enter all of that into her radiographic study. So her ID is 8, her name. She is a female. Her birthday is June 1st. She was 9 pounds. The body part that we are examining is going to be your craniocaudal radius left. And it's always a good idea to try to put which one you are doing in the study. So I will go ahead and put that we are doing the left version. But I'll also put my marker in so you'll know what we're looking at. Let's see. So I also need to put in that she is a missing short here, that she is a P9. She is altered. Technicians are going to be myself today and my preceptor Caroline. Her measurement was 3. She is not sedated and not anesthetized, and we have not taken any of these films previously. And now I'm going to register her. So we have her study ready. I'm going to now measure her radius ulna in the widest portion of the area. Since we are going craniocaudal, I am going to go in this direction. And it is reading at 3 centimeters. So to set the machine, we do not use technique charts, but I'm going to show you how the machine changes the KVPs and the MAs to accommodate for the area that we are trying to study. So we are looking at a feline, we are looking at a front extremity, and we are looking at the craniocaudal view, and we are 3 centimeters, at which point the KVPs are lower because we want a higher contrast. So now we are going to get her into position to take the x-ray. Caroline is going to position her in sternal recumbency, and I am going to use the aid of some tape to restrain her paw so that we don't get any movement or shifts while we're taking the image. So I'm going to get that down first. And then when we are ready to take the image, Caroline will be deflecting her head laterally away from this arm. And I'm going to go ahead and get it collimated. Luckily, we were able to move our table, because what I want to do is get the proximal third of the humerus, and I want to get the distal portion of her metacarpus and then center over the middle of the radius and ulna. So I'm going to collimate down and adjust my tape. And then I'm going to help hold while Caroline gets her protective gloves on. And then before I put mine on, I'm going to check one more time that the appropriate collimation is correct. I have the proximal portion of her elbow, distal portion of her carpus. We are centered over the middle of her radius and ulna, and then I need to get my marker in there. We're using lead markers that came from film, so that is why they are open. There. And now I'm going to get my gloves on. I do have the open style, but because we don't want any scatter radiation, I'm going to ensure that I'm all the way in. And then we are both going to close our eyes and look away as we shoot. And ready, 1, 2, 3. Now we're going to take a video view of a thorax on our feline patient. So I'm going to get her registered for that. I'm going to use her name, identification number for the clinic, her birthday, some other demographics for her, make sure I'm marking what doctor it's with. Then we'll get her measured, set the machine, and take our image. So I'm going to go ahead and start by putting in her ID number. Get her name in. Her birthday in. She is 9 pounds today. These are under the order of this doctor. We are going to be looking at a VD thorax. Brief description, she has domestic short hair. She is altered. The technicians will be myself and Caroline. She is not anesthetized, but we did use slight sedation so that she would be more comfortable today while taking these x-rays. So now she is registered for the site. All right, so we're going to get Miss Velvet Cuddles measured for her VD thorax image, and then I will set the machine and we will take the image. So we're going to start by placing her into our trough. And then because I do want the measurement to include the trough, I'm going to lightly place a sandbag over her lower extremities to hold her in place. And then I will take our caliper, including the bottom of the trough. And I'm going to go to the widest part of her rib cage, so generally her last thoracic vertebrae. So including the trough, we're at 16 centimeters. So that is the setting I will use. So I will start by setting our machine. We are taking images on a feline of her thorax. We're doing the VD image, and I am changing it to her size measurement. And what that has done is changed our KVPs because we want a low contrast so that we can discern the internal organs. So the KVP is actually higher right now. And we are going to get our gloves on and then get our image taken. Oh, and the marker I'm using is a lead marker from a film cassette that has been opened up so that we can use it for our digital machine. And so now I will collimate as well. I want to make sure, we are going to center the midline on the caudal portion of her scapula. Make sure that we have her thoracic inlet is the cranial border, and caudally I'm going to go down to her first lumbar vertebrae. So we've got our thoracic inlet. Our midline is caudal to the scapula. My marker is in, but now I'm being to my gloves on. And because it is still wide on the lateral borders, I want to make sure that the lateral borders only go to the edges of the trough.
Because it's going to get her ears in.
Ears in, yeah, it's got more of her abdomen now. So I'm going to go that way. So again, just double checking cranially. We have her thoracic inlet, caudally L1. Laterally, we have the body wall with the trough included. And then we will look away prior to any image taking. Shooting. body part that we are examining. We're going to do OFA standard, pelvic. So OFA rads of her pelvis, and then let's see, and she is rocked. Taller. She is altered. It will be myself and Caroline. So Caroline and I just put Mackenzie up onto the table into the trough so that I can get the correct measurements, set the machine, and then get her positioned properly. So I will be taking my caliper and measuring on the widest portion of her pelvis. Which is 12 centimeters. So while she is just maintaining, since she's sedated, just checking her respiratory rate, heart rate, and making sure her gum color is okay, I will go ahead and set our machine. We are now going to be doing Mackenzie. She is a dog. We are looking at her hips, so I'm choosing the hip setting. We are doing a ventral dorsal view for the OFA, and I'm taking it to her correct measurements. And what that has done is made it so that our KVPs are lower so that we have a higher contrast so that we can see the extremities. So we've got her top part in our V trough. I'm going to use sandbags to gently crisscross over her body to help maintain proper positioning so that her body does not roll, which will help me keep her spine and hips in line. Let's see, head is good. Now, what I'm going to do is I'm going to pull her hind legs and extend them parallel to the table. I'm going to make sure that I rotate her patellas medially so that the stifles medially so that her patella is over the trocheal groove. And then I'm going to collimate from the crest of the ilium distal to the patellas, making sure that I put my midline at the ischial tuberosities and hope that my spine is straight. So let's get that. Because of the gloves I was using, I was actually unable to fully rotate her stifles medially to the point where I needed. So we took a pause so that I could switch gloves with Caroline. And now I want to make sure that she's still in the correct position for this specific study. So again, I have the cranial border at the crest of the ilium. We are going caudally distal to the patellas. I've got her lateral both sides to the greater trochanters. Her tail is very straight in line with her spine. And now that I have gloves that I can properly control with, we are going to take some x-rays.
She's handling the sedation just great. Her respiratory rate is 10 and her heart rate is 60.
Alright, so I want to grab near her tarsus. Make sure, for me, if I can get her up here first, I know that her patellas are over her groove, and then I'm going to pull straight back while keeping them turned in. Turn away. To pull up x-rays previously taken here at my clinic, we use digital x-rays, so we use the QX system. So for retrieval of any previous x-rays, I need to know the patient's either last name or ID number, and preferably the date or date range that the images were taken, all of which I can find in the patient's file. So today I'm going to be looking for my own pet's x-rays that were taken in 2015. So I'll be using my last name and the date range to find them. So here we go. So I have my QX view up. I need to go to our database section. The images were taken sometime between March 14th of 2015 and October 13th of 2015. And then I also am using the last name of the patient, which is Hutchins. and then I am searching, and I am able to see 3 different radiographic studies that were taken during this time. And I will just click on one, and we are able to see Zoe's images here. We did an upper GI contrast study on a dog. We used barium sulfate suspension at a dose of 5 mg per kg for a total of 110 mils, which we administered buccally. Prior to administration, we took a survey image to ensure proper settings and positioning. The patient was fasted but did not receive an enema. Immediately after administration, a VD and lateral view were taken and then repeated at 15, 30, 60, and 120 minutes per doctor orders.
Yummy. It's like ice cream. Very good. It's nice. Lay down. Go girl.
I had the glove switch one was funny where I'm like, and I had to switch gloves with Caroline because I couldn't hold the dog.
But this is like real life, though. That's what's important too, is to show reality.
Does that look proper?
Yeah, looks like we got it.
Shooting.
Yep, I see you. I see the X-ray.
Shooting.
Hi, my name is Caroline Miskell. I am a certified veterinary technician at Westloop Veterinary Care, and I am Sonia's preceptor for radiology. Her strengths in radiology are that she understands fully how to adjust images in order to get the best diagnostic quality. She has a wonderful understanding of anatomy and how to position patients to get the views the doctors desire. Weaknesses, honestly, she's improved on everywhere that she was a little shaky on when we started out, such as, knowing the anatomical landmarks and collimating down to, reduce scatter radiation. But that was initially where she was struggling a little bit. And then some of the views that we don't do as often, such as like a shoulder view or skulls or something that, because we're not asked for that often, can be a little bit difficult. But with reference material, she did wonderful. She's definitely improved her radiology skills since beginning this course by focusing the anatomy and centering it appropriately and getting wonderful images for the doctors to review, as well as making sure that her technique is spot on to give the right amount of contrast desired for the image the doctor's looking for. And I think she's an outstanding student and has grown quite a bit in her radiology skills, as well as understanding her safety and enforcing that with every single patient. Thank you so much.